Well, thank you, Jim. So we're ready for questions. If people have questions, please raise your hand, and then there'll be a mic to come around, and wait for the mic. And then you should introduce yourself and just say, who you're associated with, something like that. Okay? Are there any questions? While waiting for the question, I would like to ask both Jims a question. First for Jim Glassman, with the economy improving and the Federal Reserve winding down, what will happen to interest rates? And then secondly, if interest rates go up for Jim Baumgartner, what does that do to the debt that the U.S. holds and percent of GDP? How does that change that? So.
Yeah, the minute the Fed hinted that it was going to start to slow down asset purchases last summer is when the market adjusted, the long end adjusted. You can see that if you look at TIPS yields, what the market thinks about in the future. So, but with interest rates at 2.75, we're still artificially low. And what's keeping interest rates in general down right now is not so much asset purchases. The market assumes this is over, but it's having the funds rate at zero anchors a lot of rates. It keeps everything down. And so slowly over time, as the economy does better and inflation moves back up, the Fed is going to be pushing its Fed funds rate back. The way we all think about this is a normal long rate is more like a normal 10-year Treasury yield is more like 4% if the Fed normalizes its rates. So you should know that rates are going up, but I think the issue is really the timing. The market anticipates this is going to happen. It's going to start next year, but it's probably going to be a slow process because it takes time to get the economy fully back to health and get inflation up. And these are kind of new themes that we've not really been dealing with. So we should just all recognize that rates are still artificially low, and it's the Fed's control over the funds rate that really anchors a lot of this. Mm. And by the way, just not to steal his thunder, it's true. The Fed keeping rates down does normalizing interest rates are going to raise the net interest burden, but as Jim's forecasts are showing you, that's being offset by a continuing improvement in the economy. So the overall deficit is coming down, even though the share that's going for interest payments is going up.
Right. So, well, okay. Yeah. So what we have, I know, in our forecast, like 10-year Treasury notes in 2013 were at 2.4%, and I guess it's in 2016 that we have them back at 4.3, and then 2017 4.8. And in terms of, again, the interest payments, though, are part of what we call mandatory spending. So much like Medicare spending, it's going to be paid. And so it will be an outlay in terms of the federal budget side. And again, it depends on what you're doing with the rest of the budget, what the total deficit ends up then being, and how then what happens with debt. Higher deficits would lead to the debt increasing more and vice versa. But all that is built into the numbers I was showing do build in that the interest rates will go higher. But remember, there's still debt outstanding that was there at the lower interest rates. So it's actually a process over many years where, old debt gets retired and then the new debt that comes out hits those higher interest rates. So all that whole mechanism is built into the forecast and the numbers that I showed you before.
Okay, good. Question?
Yeah, hi. My name's Anthony Clark. I'm a healthcare provider, with multiple facilities in Orange County, and a question for Mr. Gable regarding healthcare premiums and also a secondary question of where the money's going. But anecdotally, from our perspective, insurance premiums with our existing program when we went to renew increased 38% year on year. Same benefits, same everything for our relatively small 23-based employer group. And so we obviously went to market and got a different plan, and the premium increase was more in line with what you suggested, around 5% or so. However, more of the burden was moved over to the employees in the sense of co-pays and deductibles. And so that's just a sample of one. But as a relatively small healthcare provider with multiple facilities, we are experiencing or getting a flavor of what's happening throughout Orange County lately. And in the first 2 months of this year, or month and a half, I should say, it is staggering how much of our revenue is copay or deductible based. compared to prior January and February's. And so it seems to me that a significant amount of the costs are getting pushed down to the insured. And I wonder, in your slides where you indicate only 4 or 5% increase in premiums, which is probably true, but the actual cost borne by the insured is significantly higher than that. And even more so, this is even more dramatic, on the exchange-based programs who are having considerable $5,000, $7,000, maybe even up to $12,000 increases. So that was one part. The second part is, even though there's a 5% increase in premiums, so someone's kind of getting that money. Also, as a provider, we're seeing incredible cost compression, and literally across the board, new fee schedules coming out, including from Medicare, that show reductions in payments to providers. And so I'm just curious where that money is going. So.
And with regard to the first question about, with regard to Orange County, I can't say to the extent that you are that you represent central tendency or you represent an outlier. And we won't know that till we do the survey next year. I will say, as long as I've been doing this, every year there are stories in the newspaper that decry, they'll give a specific example if somebody got a 35% increase. And when we do the statistics at the end of the year, it's 7%, 5%, maybe we hit 12%, 13% a couple of times. But, there's always statistical outliers. And I just don't know how typical you are. Now, where's the money going? I'm trying to think what the national healthcare expenditures is showing, and if anybody in the audience can do it right offhand, I would say that we're seeing a slowdown in the rate of increase, of expenditures for pharmaceuticals, for physicians, a little less so for hospitals. But if somebody else has better numbers that they can tell me, I welcome it.
I'll help if I can. Cheryl Skolnick from CRT Capital Group. So thank you. This was a great panel. The optimism is always welcome, especially in the dead of winter. So thank you very much. And a couple of thoughts. First of all, a question for you, John, and this may be helpful. In considering how companies do from year to year, we develop the concept of same store. So if you think about it from a retail perspective, you want to understand for the same square footage you had last year, how much did your sales grow? I don't think you're doing that with the health plans. I think the question you're asking is how much are your premiums going up, not did you have the same plan you had last year? Did anything change about it? If so, take that person out. They can't answer the survey. Now you're left with a sliver of people who retain the same plan year over year. How much did your premiums increase? The answer will be far more than 4%. Okay, so that's step number one I would mention, because what you're measuring is this effect of switching and bidding against a higher premium of a plan that no longer wants to take on the risk of your group now that they know who you are and how much you cost, which, by the way, happens to us all the time in our 300-person group. Second, where is the money going? So one of the things you need to consider is that this year the premium tax was implemented for these health plans in their renewals that end in the benefit year of 2014. So immediately you started with at least 2.5% increase in your premium before they even considered any underwriting, because they all built that into price. So part of it is going to pay for ACA. Part of it is going to pay for ACA because the health plans also have issues with making sure that their rebates are managed well, so that if you want to spend more on people because they are sicker or because you want to spend other things or you want to have a bigger profit margin, you have to make sure that you manage your premiums extremely carefully and closely. That actually served to perhaps limit the rate of increase of premium. And the third thing I'll mention is absolutely, this is a huge risk that the stock market investors in healthcare do not understand. The increase in copays and deductibles means that bad debts for hospitals and providers will not go away. It could even get worse. We are making the provider community the insurers of last resort again. So you spend $155 billion over 10 years to get relief as a hospital industry, you're not going to get it. So that's kind of what's going on. But the money is going to hospitals, doctors, other kinds of providers, but and more in the outpatient markets than the inpatient markets, from what we see from the publicly traded companies.
Any comments on the panel? Yeah. Okay. Any other questions? Oh, there's a question over here.
There's your microphone.
Oh,
Janelle Hollett, Aliso Health Management. With current emphasis on fitness and health prevention, and with less invasive outpatient surgeries, is there any indication that the boomers will have a better quality of life at age 85?
Well, first of all, on employer wellness plans, probably the best study was by Rand. And the way the study was designed, they compared participants with non-participants in the wellness programs. And lo and behold, the participants did better. However, that's bad comparison group, right? Because there's self-selection who participates in the wellness group. So I don't think it's firmly established whether the wellness programs are actually reduce spending for employers. Will it improve their outpatient surgery? I'm not sure although on an individual case it may cost less, there may be an increase in the number of procedures that can offset the reduction in the cost per procedure. And there's also a lot of selection going on, meaning the more the higher paying patients go that use outpatient surgery. The Medicaid patients and the uninsured patients go to the hospitals. So again, I'm not sure how much savings are actually realized by the growth of outpatient surgery.
But for sure, the behavioral changes between our generation, and I think about my parents when they were where I am, for sure, this has to be changed. You know, it's why life expectancies are rising, and for sure, it's got to be affecting health.
But again, I think it's very much socioeconomic related. In fact, I think that the statistics show that the life expectancy at age 60 or so for college-educated, middle upper, is going up. For the lower ones, the lower income, there has been no change. And recall, this is a nation which is 1/3 normal weight. I'm doing averages. 1/3 normal weight, 1/3 overweight, and 1/3 obese. So the question is, can we get the people? Can we bring wellness to the 1/3 obese and the 1/3 overweight?
So if I could just add something about from the smoking study that we did a year or two ago. And of course, smoking's only part of that. And what was true in the smoking analysis would not necessarily carry over. But what we found there is, so for the employment-based age group, having less smoking did decrease healthcare costs somewhat. But the problem is you had then more people living to be on Medicare, and Medicare in the first 10 years had reductions in cost, but after about 10 years from a significant smoking cessation, then Medicare costs indeed were higher from then on, and it's something else is going to get you, and something else is going to run up healthcare costs. And again, you look you can look at non-smokers who are 80 years old, and their healthcare costs are awfully high on average. I'm all for putting it off as long as we can, but where it hits the federal budget, I think you have to remember what does the federal government tend to pay for,
So I think we just have time for one short question. Go ahead.
Yeah, hi. My name is Mark Cormany. I own a brokerage firm in Irvine. I do small and mid-market groups. And John, I'm always amazed at your creative writing because I think I must be the worst insurance broker in the world because my clients don't get anywhere close to the numbers that you project. This year alone, the taxes with the Affordable Care Act are 4%. So that means, by your numbers, that trend was flat, which I don't see. Also, there's a tsunami sitting out there right now where the majority of my small employers with under 50 employees, they all moved their effective date, their renewal date, from whatever month it was to December to delay the effects of the Affordable Care Act. When I shopped the market, and we diligently shopped every one of our clients, we didn't just say, move early because it's going to make sense. We actually did the math for every one of our clients. And on a whole, what we're seeing is that the rates for December, as projected, are going to be 30% higher than they are currently in the small group segment in California. And it's statewide, not just Orange County. Some areas are even worse. And to support what Cheryl said, if you look at benefit parity, there is none. The benefits are far worse. So I'm really going to be interested next year for your numbers because they're probably not going to have December in it because it's probably going to be a survey of all these employers that have delayed their rate increase until December of next year. But besides that 30% increase they're going to get and the benefit reduction they're going to get, you're also going to have these carriers that are underserved at that time because it's open enrollment for Covered California, it's open enrollment for Medicare, it's open enrollment for large employers, and you're going to have a significant portion of your small employers renewing at that same time. It's going to be utter chaos, and it's not going to be 4%.
Okay.
So that wasn't a question.
No, I think on that. I think on that very happy note.
May I reply, though?
Oh, sure. Okay, quick, please.
First of all, we'll have an answer sooner than next year. The Commonwealth Fund has funded NORC to do a survey of small employers. We're going to be in the field shortly, and we hope we can release the results by, say, August of this year. I just want to note, if you have a 4% tax and it's for reinsurance, risk adjustment, and risk corridors, yes, there's a 4% tax, but premiums are priced much lower because of the risk.
The tax is built into the premium, so when you're talking to an employer, it's part of the nut.
But the carriers are not, as a result, their estimates are 8% or so. They're pricing their premiums 8% lower because they are not taking as much risk. So,
Well, I think we'll have to wait till same time next year.
So, and let me just note, this was the same way it was done for Medicare Part D with the 3 Rs. And again, the purpose, one of the effects of it is there's less risk taken by the carriers.
Okay. Well, thank you. We have a coffee break next, but thank you for the panel.